Hi, everyone. Welcome back to our colloquium. Today, we have Dr. Heather Frederick with us. I'm so excited for this discussion. I've been waiting for this for a month ever since she decided to do this on self-care and burnout in nursing and how to prevent that. Not just speaking about it, but then giving us tools to prevent that. And I would probably I think it's coming that you could probably use those tools that she's going to teach us about burnout in other areas of your life is what I'm probably thinking because she's a big picture person. So I'm going to hand it right over to Dr. Frederick. Welcome, Dr. Frederick. We're glad to have you today.
Thank you so much, Dr. Olin. And I am super happy to be here today and talk to you guys about one of my all-time favorite topics, which is self-care. And yes, this session is focused on the nursing profession. However, I promise you, if you are not a nurse, you will be learning things today that you can apply immediately. I did design this talk to be highly interactive. So I'm hoping you're in a place where you can navigate to your chat, answer some polls, and have a piece of paper and a writing utensil handy. Let's talk about the goals of this session. And where is there we go. By the end of today's presentation, you will be able to differentiate burnout from other words we use a lot, like stress and compassion fatigue. You'll be able to describe how behavioral science impacts the adoption and the maintenance of sustainable self-care. You'll learn how to apply evidence-based strategies to reduce burnout risk and promote your personal resilience. And finally, and my favorite, you're going to walk away with an individualized action plan that enhances your well-being, your performance, and patient outcomes. I'd like you to take a moment and think back to your last really difficult shift. If you're not a nurse, just think about your last really difficult day. This is not your average run-of-the-mill day. This is one of those days where it feels like everyone you're interacting with is uncharacteristically challenging. This is the day you forgot your lunch. This is the day you were short-staffed. This is the day where you're running from room to room. You get in the car, you drive home on autopilot, you walk through your door and you think, I should probably do a little bit of yoga. Maybe I should cut up an apple. But instead, you find yourself sitting on your couch, mindlessly scrolling, maybe through Facebook or Instagram, grabbing a bowl of cereal. Maybe you even eat it over the sink, and there's this little voice in the back of your head saying, oh, I know better than this. I can do better than this. But you just don't have the energy. I'm curious. Has anyone experienced a day like this? And if you have, I'd love for you to type it in the chat. Today, I'd like to suggest something that might surprise you. Because usually when we have days like that, we say things like, I just need to be more disciplined. I just need to try harder. But what if the problem isn't your willpower? What if the problem is a misunderstanding of how behavior change works? Today, I'm going to encourage you to let go of the myth that you need to try harder, and that's what's in your way, and embrace this idea of design over determination. So what we have when we have days like this is a situation where we're often working against our brain, and today's talk is about working with your brain. So let's see how talented I am here. Dr. Olin and I practiced beforehand. I'd like to launch a poll. If I can get over to that part of my screen. And I have a question for you guys. We're going to talk about terms. And let's see if, hopefully you are seeing a poll on your screen. And the question is, which of these terms do you think people use interchangeably most often? The choices are stress and burnout, burnout and compassion fatigue, stress and compassion fatigue, or D, look, they're basically all the same. I experience in them just about the same. I'm going to give you just a minute here. Most of you have responded. There we go. I'm going to end the poll and share the results. And what you see is that there is this tendency to talk about these terms interchangeably. But what's important from a psychological perspective is that these are very different experiences, and we need to understand that. Can someone confirm you're seeing the correct slide and the poll is gone?
See it.
Great. Okay, thanks. So stress. This is the result of demands, pressure. It's short term, it's episodic, it's normal. We have a stressful conversation, we have a stressful meeting, we have a stressful day, we have a stressful week. We can engage in self-care, we can recover by taking a day off. It's a normal part of life. Self-care is one way to reduce it. Compassion fatigue is repeated exposure to patients or other individuals suffering in trauma. It can occur suddenly, and it's associated with the emotional cost of caring for people who have trauma. Yes, self-care can be of assistance, but sometimes in the case of compassion fatigue, you also need to be considering things like trauma-informed care. So stress, compassion fatigue, a type of stress. Burnout is something very different. Burnout is chronic workplace stress that exceeds the available resources. It develops over time. It is considered an occupational syndrome that is the result of unmanaged chronic stress, and it's not so easy to relieve or to recover from. What we know from the scientific literature is that there are two avenues, and both are very important. Individual interventions, what can you do? And that's what we're here to talk about today. But also very, very important, and I don't want to discount this as part of this talk or kind of feel like this is being pushed to the side, is the organizational factors, the environment of the workplace. Again, research suggests changes in each have positive results. Today, we're focusing on the individual. What can you control? What can you do? But I'm hoping there's someone on this call, or maybe someone watching a replay, who has something to say about the workplace, has experience with modifying environments to make them a little more consistent with a burnout-free workplace, and that you'd be willing to give a colloquium on that, because then that would make this a much more holistic conversation. Let's launch the second poll. And the question here is, let me go back. Okay, you guys, thanks for hang on. I'm giving you time to navigate back to your screen. This question is related to contributors of burnout. What do you think contributes most? Is it the long hours, the difficult patients, the staffing shortages, the constant decision making that you do when you're on the floor, or is it all of the above? I see we're all in good company here. We're mostly feeling like, hey, you know what? It is usually a combination of many things happening at work. Again, this idea of the demands, what you need to do to perform your job effectively, isn't matching with your available resources. I do want to say, sometimes I think we hear the word burnout a little bit like a catchphrase. I'm burned out with this person. I'm burned out with this location. Operationally, in the literature, burnout is an occupational phenomenon. It is tied to the workplace. It results from stress that isn't successfully managed. Again, today we're going to talk about what can you do as an individual to manage that, taking into account that the environment is very important. It's characterized by three dimensions: feeling depleted or exhausted, feeling negative or cynical about your job, and finally, reduced professional efficacy. What's important to notice in that definition is what doesn't appear. Burnout is not a personal failure. There's no indication it has anything to do with weakness, laziness, or lack of resilience. In fact, burnout is very predictable. It is simply the result of prolonged workplace demands exceeding the resources you have to cope. And self-care is one of those coping mechanisms. Let's talk about these three areas because in order for you to experience a state of burnout, again, what's different from having a stressful job or having a stressful week or maybe a season? How does that differentiate from being burnt out and suffering from this syndrome? You're going to see and experience three signs. The first is exhaustion. We hear a lot about this idea of filling up your cup, filling up your cup. In fact, one of the colloquium speakers, I had never heard this before and I loved it. She said she pours from her saucer. I mean, not just fill up your cup, but fill up your cup so much that you've got overflow and that's what you're giving to others. I loved that visual. But feeling like your cup is bone dry. That's sign number one. Sign number two is this depersonalization aspect, this idea where you're starting to feel negative about your work. You're starting to feel cynical. You're distancing yourself from your work, your patients, your colleagues as a way of coping. And these two typically together then lead to reduced professional efficacy. This is a really super important point. I want everyone to really pay attention to. As someone who may be burned out, you may question whether or not you're still doing a good job, but here's what's interesting for the leaders in the room. Sometimes the performance is still very strong. So while the individual may be questioning themselves, they may still be performing very well, or they may not. The professional efficacy may go down. But what's a very interesting finding in the literature is that someone may be coming to work looking like, hitting all the metrics, not being late with anything, still performing, and yet be suffering from burnout. And the signs do reinforce one another, but I think that point is an important one, especially for the leaders in the room. Let's do a reflection exercise where you pause for a moment and think about what you've observed in the workplace, or maybe what you've experienced yourself. What type of warning signs do you notice? And while you guys are doing that, and I'm figuring out how to navigate to the chat, I'm going to share some of the ones others have shared with me. Getting irritable, kind of being snappy with your colleagues might be a sign. Back pain, sometimes it exhibits itself in a physical way. It may be something like not being able to sleep at night, having insomnia. I love the chat, purposefully putting things off, purposefully ignoring things. You see an email, you see a message, and you're like, nope, not right now. Tension in the jaw, procrastinating. Procrastinating is a big one. So understanding the signs and being able to see the signs are going to be an important part when we think about design. So thank you everyone for sharing loss of interest, feeling maybe more easily overwhelmed, minimizing things that are really important, all signs of burnout. Let's talk about Maria as a case study, and her story may resonate with you or someone you know. She's a very experienced nurse. She is deeply committed to her patients. In her heart of hearts, she knows that her life calling was to be a nurse. But lately, she's leaving her shifts feeling like she has nothing left to give. Nothing left to give herself, nothing left to give her colleagues, her patients. It can even trickle in to the home life. Maybe she feels like she has nothing left to give her partner, her kids, her friends, her family. She's feeling detached. And for Maria, this comes out as being impatient and kind of distancing herself from her patients. And so she's beginning to wonder if this is where she's supposed to be. Am I still making the difference I felt like I was when I first became a nurse? Now, Maria knows at the end of that long shift exactly what she should do, right? Nourish her body, do a little stretching, call a friend and vent, ask for support. But she doesn't do it. Maria does not have an information problem. Maria has a behavior change problem. When I was working on my dissertation, I was incredibly unsuccessful at managing the stress, and I developed a twitch. And I signed up for a stress reduction class. And the facilitator got up in front of the group and said, information is to behavior change as spaghetti is to a brick wall. And then she just stood there for minutes and let us think about, what on earth does spaghetti have to do with a brick wall? And the punchline was basically not a lot. There's not a whole lot that a spaghetti has in common with a brick wall. Because think about it. If information alone changed our behavior, then wouldn't we see every healthcare professional eating nourishing meals, getting enough sleep, exercising, right? And we know that's not what we see. We know we would feel better if we took a 5-minute walk, if we meditated for 3 minutes before bed, or if we ate something healthy. But Maria's exhausted. She's burned out. And after a relentless shift where her brain has been working as hard as her body, running from room to room, she's suffering from things like decision fatigue, cognitive overload, and depleted energy. Here's the good news. Psychology in the field of behavioral science helps us understand when we're tired, when we're burnt out, what can we do to start to dig ourselves out of this hole? We start by understanding the behavior, designing a supportive environment, building routines. And if you walk away with only 2 nuggets from today's talk, I hope one is make the healthy choice the easy choice. When we're tired, when we feel like we have nothing left to give, we need the healthy choice to be the easy choice so that the behavior can be sustainable. Okay, see, I'm giving you guys a break from listening to my voice with these polls. Poll number 3. Let me get that up for you guys while you're thinking about what it feels like at the end of a heck of a long day. You've had a full day of work, and when you come home, do you come home completely drained with nothing left to live? Feel like you're running on fumes and you can manage only the essentials, brushing your teeth, perhaps? Half a tank, you've got some energy, but you need to be really, really selective. Or do you come home feeling energized and you have plenty of time, you feel like you have plenty of time and energy for healthy choices? Or do you feel fully energized, like, okay, guys, I'm home. I'm ready to take on the rest of my day. I'm going to share here what everyone says because we have a really interesting distribution where the people on the call today are very variable. And I'm hoping when we get to the part that's much more interactive, some of you who are coming home fully energized are willing to share what you're doing, so that's your experience. I do want to spend a little more time with this concept of decision fatigue because, especially in the health profession, nurses, other professionals are making hundreds of clinical decisions every day, hundreds of really super important decisions. And this leads to a depletion of mental resources. So, your brain at the end of a long day is going to naturally seek the easiest option available. Listen up, this isn't a weakness. This isn't a weakness. You're human. This is an adaptation. This is an adaptive response, giving you a chance to conserve some energy. So, after a long day of making a lot of decisions and being cognitively tapped, often sitting on the couch and scrolling through your phone or crawling into bed with Netflix is what happens because it's the easiest choice. It's the choice that is saying, this is what will conserve your energy. Okay, well, understanding that, how can we turn some healthy behaviors into habit that don't take a lot of energy? And how can we do these things throughout the day so that we're not relying on taking care of ourselves after the end of a heck of a long shift? And I want you to think of this in terms of a cue, a routine, and a reward. So again, the idea here, and I'm sure many of you have heard about this technique, is rather than thinking you're going to do this complete lifestyle overhaul and start a whole bunch of new behaviors, what teeny tiny, and I'd love for us to start small today, what teeny tiny behavior can you attach to something you're already doing? For example, after I finish charting, I'm going to take 3 slow breaths. And I'm going to notice the tension release. While I'm washing my hands, I'm going to say my mantra 10 times, a statement that you would find encouraging. I love you. I got this. When I'm calm, I have clarity. Whatever statement would shift your perspective into one of a more positive state. And then at the end, you take just a second to notice how maybe your perspective has changed. Maybe you're going to put a water bottle somewhere that you pass often. And when you see that water bottle, you're going to stop and take a sip. And you're going to notice that by being hydrated, you have more energy. The second thing I would love for you to take home from today is design over discipline. How do I make the healthy choice the easy choice? And right, design over discipline. Stop asking yourself, why am I not following through? How can I try harder? And start asking yourself, come on now, how can I make the healthy choice the easier choice? So usually we talk about reducing friction, right? Meal prep. No time for meal prep? Okay, swinging by Sprouts on the way to your shift and picking up a bag of organic carrots or pre-sliced apples. Placing your walking shoes by the door. Buying a new yoga mat to replace the one your dog chewed up last year. Actually blocking recovery time in your calendar. Or like the example I just gave, pairing some breath work with hand washing. Just as important is thinking about adding friction to things depleting you. So sometimes I have people say, you know what, Heather, actually, I have a pretty decent self-care practice. And maybe the people who responded that they still have energy when they come home are practicing self-care in the morning before work, throughout their day, and you'll have time to share that at the end. Or sometimes people say, I'm feeling so overwhelmed. I'm feeling so fatigued and exhausted. The thought of adding something else is stressing me out. And to that, I say, no problem. Let's talk about the things that are depleting you that you can stop doing. What about stopping that that flow of depletion. I have 4 here that are highly successful, but they take a lot of courage to do. One is removing social media from your phone, like literally take it off. That sounds way too scary and that's too much of a jump for you. What about turning off your password autofill? So when you grab your phone, you click on your favorite social media app, you have to pause to put in your password, and that gives you the opportunity to ask yourself, is this where I want to be right now? Is this the best use of my time? Or if nothing else, while you're filling in the password, maybe you can take a deep breath. Moving the TV out of the bedroom. If you're having issues with sleep and you know you want to do better about reducing the time you're spending in front of the screen, what about just removing it completely? Sometimes, at least I know from my experience, I can get hooked on a series, Netflix, Amazon Prime, Hulu, whatever, and I will find myself kind of binge watching as a way to, I tell myself, oh, I've had such a long day or a long week. This is my treat. This is my treat to myself. But what I know is that it impacts my sleep in a negative way. You can schedule your internet to turn off. You know, the little outlets you plug into the wall for maybe like Christmas tree lights or something? You could plug your modem into that and make a decision that every night at fill in the blank, you know how many hours of sleep you need, 9 p.m., 10 p.m. It's not even an option. Remove the things that are depleting you. Everything that I'm sharing here is about designing your environment to, again, make that healthy choice the easy choice. If it's the easier choice, you're going to be more likely to do it. It'll become a habit and will be sustainable, and you will see benefits. So I'm curious. I've been talking a lot, and I'm wondering, has something popped into your head that you're like, you know what? This is the healthy behavior that I would like to make easier. What healthy behavior would you like to make easier? Is it related to nutrition and healthy meals? Is it exercise? Is it meditation or breath work? If you're willing to share in the chat, what healthy behavior would you like to make easier? And once you've come up with that behavior, think about, you don't need to share this. You can jot this on a piece of paper. You don't need to share this in the chat. What teeny tiny environmental change could help you do that? Remember, design over determination. Design over determination. What could you do to your environment to make this easier? So at this point, we've explored why good intentions fail, why we don't do the things that we'd like to do when it comes to self-care. This framework is something that can help you create the habits that we're talking about. SPARK stands for see the signs, pause with purpose, adjust your environment, repeat small wins, and keep learning. So let's take each of these letters in turn. You know, self-care really begins with awareness, and it's so important that we don't ignore the signs, but that we acknowledge them. And so sometimes we have to take a moment and really reflect on, what are my signs? What happens to me when I'm becoming depleted? Typically, these show up in a physical, emotional, cognitive, or behavioral domain. You may have multiple signs, but I would love for you to think about what might be the very first one. Is it, for example, neck pain? Is it feeling anxious, feeling irritated? Is it brain fog? Is it the inability to make a decision? Or maybe you noticed you're becoming depleted when you start making mistakes. Is it behavioral? Like you have a hard time sleeping. You feel like you must take a nap in the middle of the day or you're stress eating. If you're willing to share in the chat, what is one of the first signals you notice when you're becoming depleted? What are some of the first signals you notice? Insomnia is a big one, and often that's related to not being able to turn our brain off, kind of that monkey mind. Boredom, that's interesting. It's super important that for this spark framework to work well, that you've done just a little bit of reflection and that you feel confident in knowing when these signs are appearing. Eye twitches. My twitch was on my arm. It was very bizarre. The P stands for pause with purpose. So here is where we intentionally create space to respond rather than react. If you've heard any of my talks before, you've probably heard me quote Viktor Frankl, because my all-time favorite quote is his, and it goes something like this. In between stimulus and response, there is a space. And in that space is our power to choose our response. And in our response lies our growth and our freedom. And so when you pause, wait, my eye is twitching. Wait, I'm suddenly feeling bored. Hey, last night I took a really long time falling asleep. You ask perhaps a question like, what do I need right now? While you're asking that question, I would like to encourage you to consider a few concepts. And one is how compassionate you're being with yourself. I find it fascinating that most of us will treat a colleague, a friend, a stranger kinder than we will treat ourselves. And then being mindful as you're asking this question, you're not beating yourself up. Darn it, there I go again. You're simply stating without judgment how you're feeling. I'm exhausted. I'm overwhelmed. What do I need right now? And acknowledging that, especially if this is happening in the middle or at the end of a long day, that you're probably suffering from decision fatigue. And so, what you need right now in the choice about what you're going to do to try to get you out of this situation needs to acknowledge you may have few mental resources remaining, right? What you're going to do to assist yourself needs to match your energy level. A stands for adjust your environment. So changing the system instead of blaming yourself is going to give you a win every time. Stop wondering why the heck you aren't doing what you said you were going to do, and put all that focus, all that energy on deciding what needs to change. I'm not saying you need to give up your favorite Netflix sitcom, but what if, like Dr. Olin suggested before we started recording, you put your computer on your kitchen counter and you chop up some veggies and fruit every Sunday for a couple of episodes. You do some meal prep. What if you bring in some self-compassion and understanding about decision fatigue, and when you're writing out your self-care plan for the week, you match your plan to the energy you know you're going to have left because you know yourself best. Little cues, creating a routine, putting your walking shoes by the door. And again, today's focus is on something teeny tiny, small. Maybe you walk for 5 minutes. And of course, scheduling recovery time. And here's the thing. I can't tell you how many people I've met that say, yep, I have something in my calendar every day to stop for 10 minutes or so. And then you ask them how often you do it. And they go, yeah, well, I do it maybe 10% of the time. How many times do you not show up for a meeting with your boss? Oh, no, never. I always attend those. So why is this meeting on your schedule not as important. Making the healthy choice is the easy choice, is the name of the game. R stands for repeat small wins. And oops, hey, let's not get ahead of ourselves. There is a concept in the field of psychology called self-efficacy. You all know what it is, even if you don't know the term, because it's our belief that we can do something and do it well. And that can be anything. I know I can be a good nurse. I know I can be a good leader. I know I can be a good partner, a good mother, a good athlete. Fill in the blank. There are a lot of ways to build self-efficacy, but the number one way is through experience. Believe me, I'm huge on visioning. I love mantras, but you need to go beyond telling yourself things or thinking about things and actually having the experience to consistently build self-efficacy. So that's why small and repeatable is always going to win out over ambitious and short lived. Why? Because if you walk 10 minutes a day before or after work for 2 weeks, you know you can do this. You have the experience that you can do this, and that will build your confidence. And self efficacy is one of the number one predictors for any behavior. Versus what some of us do, especially around the new year, is something ambitious that ends up being short lived. That's it. I'm exercising for an hour every day. I'm meditating for 20 minutes. I'm taking back my life. But after a couple of days, you're not doing it anymore. Now the message is I'm not disciplined. I can't do this. So if you're willing to type in the chat, what is one action you have the confidence, you have the self efficacy, you believe you could repeat even after a very difficult day? What's one thing you think you could do? And you guys, this can be tiny. I could take 3 deep breaths before I put the key in the ignition or press that button to start my car. I could take 3 deep breaths before I open the door to my house. What's one action you could do even after a really hard day? This is important because knowing what you think you can do with your energy level is what's going to build the habit and make self-care sustainable. K stands for keep learning. We know that reflection is how our experience becomes wisdom. Reflective practices are very common in the field of education, very common for nurses. It's this asking of yourself, what's working well? Is there something that needs to change? Getting curious when something doesn't go as planned, why, and how you may be able to make some simple changes to change the result next time. So this practice is something that can happen at the end of a week. Some people do it every Friday before they say, okay, it's done. I'm about to close out my email. I'm going to just sit here for 5 minutes. Maybe you journal. Maybe you just think, this is how my week went. Okay. These are the things I thought I was going to get done or thought I was going to accomplish, and this is what actually happened. Maybe you do it on Sunday. Hey, let me reflect over the week. How can I take this reflection and make some changes so the next week looks different? Maybe you're doing it at the end of every day. Maybe there's something that you're really trying to develop with yourself in terms of self-care that you're doing it multiple times a day. What's really important is when you're reflecting that you have a growth mindset. A lot of highly competent people will reflect on things that didn't happen and use that as evidence for failure or how they didn't perform the way they thought they did. But a growth mindset says all that information is simply feedback. It's just feedback. So what if this information you're reflecting on isn't, again, having you beat yourself up? I said I was going to do this. Why don't I do this? I have no willpower, to saying, well, this is interesting feedback. I'm curious about what happened this week. Let me think about that. Okay, if I take these points as feedback, then how can I continuously improve? What small, tiny change could I make that may result in different outcomes next week? And I promise you, small changes over time have an insanely powerful cumulative effect. Please do not underestimate the power of 3 deep breaths every time you wash your hands. Try it, see how it goes. The goal is not perfection, it's never perfection. The goal is progress. So here's where I would love you to get out that piece of paper and a pen or pencil. Now, I get it. Some people want to do it on the computer, and if you must, okay. But there is research that suggests when you put a pen to a piece of paper and write, it literally fires different neural pathways. And you can do, I actually, you could do an experiment with yourself. You could do this on your computer and then do the same exact activity writing and see if different things come out. So you're going to write spark down the side of the page and then fill in the prompts. You don't need to share these in the chat. But we've been talking about signs of stress, of burnout, of depletion, and you've had the opportunity to think of what yours may be, but also read others, because sometimes, honestly, we're not aware of some of our earliest signs. So if you were to pick one sign that you're becoming depleted and it's time for you to pause and make a shift so that you can take care of yourself, what might that sign be? Go ahead and write that down. And then for pause with purpose, you may have liked the question I gave you, what do I need right now? And if that question resonates with you and it's something you could see yourself saying, then write that down. But maybe you have a different question. Maybe your question is, how could I love myself right now? Maybe your question is, if my child or my best friend was experiencing this right now, what would I suggest to them? You want a question that resonates with you, that feels natural to you, so that when you pause, you notice the sign and you pause, you have a question that you ask yourself. For A, adjust your environment. I gave you an opportunity earlier to talk about a change that would make a healthy behavior easier. And people have been sharing in the chat, which I appreciate. But now that we're coming towards the end of the talk, what's one change that would make a healthy behavior easier? One change that you can think of. Removing the TV, removing social media, meal prep, beginning in buying new shoes so that you want to go for a walk. What's one change that would make a healthy behavior easier? And then here's really the gem of today's session. What is your tiny habit going to be? What is your teeny tiny habit? I keep going back to the hand washing and breath work because we all do that. Whether you're a nurse or not, it's something that could be applicable to anyone. Is your tiny habit going to be that at least once a week you bring something healthy to snack on? Is your tiny habit going to be committing to drinking more water during the day so that you're hydrated? What's one tiny habit that you're feeling really good about right now that you could do when you're feeling depleted? And then I would like to encourage you to think about how often you want to reflect on this. Is it something that for now you want to do every day? You could even set an alert on your phone or put it in your calendar. Maybe if you're a journaler, this would be very easy. Maybe you want to buy a journal, or even just, micro journaling is really big now. It's one sentence, right? You write one sentence at the end of the day. Or do you already have a routine that you want to do this weekly? But think about when you're going to reflect so that you can get feedback and use that feedback to design your environment to make the healthy choice the easy choice. We've come to our fourth and final poll. And the last question I have for you all is, can you commit to one action this week? It's not a yes, no question because I'm offering you a can I think about it, which is totally fine. But can you commit to taking one action this week that would put you on the road to sustainable self care? Again, as an individual in potentially a very stressful work environment, doing what you can to build your resilience, doing what you can to buffer yourself from burnout. I see that we're all in really good company here because 100% of the people who answered the poll said they are on board. They are going to take that one action. If you want to share it, you can, but no need to. A lot of times, people like us, you're here getting some continuing education, listening to a colloquium. You like extra credit. Your extra credit is to identify an accountability partner. Research shows we're more likely to do things if we have someone holding us accountable, supporting us. So maybe jot down that person's name on your piece of paper or text them and say, "You're it." I'll explain later, but identifying someone to hold you accountable or a self-care buddy does result in better outcomes. So in terms of some final take-home messages, you guys, burnout's not personal. It's not personal. It's predictable. Research has shown us why burnout happens. There are workplace resources that exceed the demands. I'm sorry, the demands at work exceed your resources. Self-care isn't just this extra thing that we should all be doing. Think of it as part of your professional practice. Think of it as part of your professional practice. Again, design beats determination every day of the week. And small actions repeated often are going to build that self-efficacy, build your confidence, and result in more sustainable behaviors. And finally, remembering Spark, because that can turn your insight, your awareness into daily action. Again, this is not about a major lifestyle overhaul. You just have to decide to begin, which everyone here has today. And again, over time, you will see results. So I'm going to stop sharing and open this up for comments, feedback, questions. I'm also going to navigate over the chat and see all the things that I missed.
Hi. Oh, that was wonderful. I was busy jotting things down and I was like, okay, this is what I'm going to do differently. And I was joking a little bit about the scrolling and walking, but at least you're adding adding something in. Now, what I've actually done is I have started to listen to podcasts while I'm walking instead of scrolling or trying to catch myself. Oh, here I'm feeling overwhelmed or anxious or whatever the feelings are. And I grab right away, you grab your phone and you start to scroll. I'm trying to be like, oh, okay, nope, you need to get up and walk. And often I'll say, well, if I can't walk for an hour, then why even bother? And
Right.
so I've been doing really a lot better with 10 minutes is enough. 10 minutes is enough. 10 minutes is enough. And it seems way more doable to do 10
Mm-hmm.
minutes in the morning, 10 minutes in the afternoon, and 10 minutes in the evening. And that's a 30-minute walk in a
And then
day.
add that up over the week.
And then add that up over the week. 10 minutes is nothing. It's commercials on TV. It's really, it goes so fast. I do have a couple of different things, and I'll let other people talk. But one thing I was thinking of is you need to add this as the class for high schoolers instead of
Mm-hmm.
home ec. Home ec was important before. I don't know if home ec is as important in today's world, but I think this is. I have a 15-year-old niece. She's a girl, and the children today are bombarded with social media and their phones and electronics and all of that. It's just bombarded with that, scrolling, constantly scrolling, but also with my niece, just her. And I remember my children as well when they were this age, they're so busy, they don't even have time to even think about what self-care looks like,
Hmm.
any of that. And then I think their nervous system develops in this state, the state that they're in, and then they become adults and they don't know what self-care is and they don't know how that feels and they are constantly searching out that feeling of busyness or whatever it may be that kept them safe when they were younger, except for now, they're starting to feel burnt out because now they're 30,
Hmm.
40, they have children, they're raising kids, they're working full time, their husbands are full time or whatever. And now all of a sudden they're in burnout. So I really think hitting our children and teaching them from early on, it needs to be through school. It needs to be in the curriculum, what self care looks like, how to do it, the tools to use it, so that as children, they can learn to integrate that into their lives moving forward, because it's very hard to break a habit once it's ingrained in you. It's very, very hard. And
Yes.
I see my niece struggling already as a 15-year-old with burnout. And that's not even, it's not even in life yet. And it worries me about our youth. The other thing that I loved, you said was about, uh, when you feel burnt out. Okay, there's a young woman, 30 years old, has a pretty high powered position, career, and was speaking with me the other day where she was saying, I get home from work and I really feel like this is what they said. Doesn't have kids yet, just engaged, um, gets home from work and just feels exhausted already. And what she said to me was, I just need to figure out how to find more bandwidth within inside myself in order
Mhm.
to do what I need to do in my life. And I said, no, you don't. You need to outsource more and find more resources to either help you or for you to lay that down. One of those was, can you afford a housekeeper? Maybe some
Yeah.
people can't afford it, but if you can afford a housekeeper and you're a mother of three and you're working full time and you can afford a housekeeper to come in every couple of weeks or every 3 weeks to do the big stuff, that can take such a load off just doing that. Is that something that you can outsource? So they were
Yeah.
wanting to find more bandwidth to be able to do it all. And I'm saying, no, let's see where there are pockets where you can find an outsource to other things, outsource to friends, outsource to, I don't know, other family members, whatever it is. Can grandma come and get the kids twice a week and take them out for supper so you're not worrying whatever it may be. But
Hmm.
I think we're so trained and so ingrained, and I'm just speaking for women, um, that now instead of being at home working at home and managing all this, we're working full time and also raising kids and also doing all the things, and you're going to hit burnout in life. You are. I see it all the time in the 30 year old women that I know now, the younger generation. And what we need to teach them is all of that is important, but also this is important. Self-care, checking yourself, having tools, all of these things, find outsourcing, all of that. Because like what you said, Heather, it's not about being lazy. And a lot of times we think, well, if I'm burnt out, I'm just lazy. I'm just laying around and I'm burnt out. It's not that. It's an actual physical reaction, a mental reaction to the stress and just being overwhelmed and overloaded. That those are all my comments. So
Yeah, thank you for those. I agree. And we've got comments in the chat box about the youth. And, I think one of the number one things we can do is be a model for the youth. But believe me, there's nothing I would love more than to see curriculum standardized across elementary school where the first thing everyone does is, raise your hand if you're feeling good about your vagus nerve today. Oh, most of the class isn't raising their hand. Let's do some humming breaths. Let's do some, right. You guys know me, and that's my jam. I would love to teach about the vagus, 5 year olds about their vagus nerve and what that means. But it starts with us. If we model, and you gave great advice. Resourcing is one of the number one things. Delegating, right? Boundaries. Sometimes I've had people say, I don't have resources. I live alone. I live away from my family. I don't have money for that. Well, what about reducing expectations? What if it's okay if the dishes are there for one night, or you only do laundry once a week, or you let your kids clean their room and you say, and that's okay. That's their definition of clean. I'm going to be okay with that this week. So sometimes it's about reducing expectations, but in the end, like you said, it's always comes back to being self-aware, how you're feeling and how you're managing stress, because being in a human body is stressful. Whether you're a nurse or you're not, we come up against stress every day. Stress isn't always bad. Stress is what motivates us to do things, but how do we manage it and keep it at a manageable, optimal level, especially in today's world that is incredibly polarized? One thing we know is when the amygdala hijacks your brain, right? When you're feeling stressed, we often say and do things we wouldn't normally say or do when we're not stressed. And we see a lot of that out in the world today. So, teaching people how to manage, take care of themselves, see the signs, pause, I think will have benefits for everybody. Does anyone else want to come off the mic or type in the chat? Comments, questions? So we've got 2 minutes left. If not, we can give everyone 2 minutes back to do some deep breathing before they start their next meeting.
Sounds like a good plan.
Thanks for you guys for coming, for playing with me today, and just for being here.
Thank you, Dr. Frederick. I appreciate you being here and presenting today. And remember to look out for all of the upcoming monthly colloquium events that we have for the university. And sometimes the CEUs for nursing are attached. They are today. So if you are a nurse and you would like a 1 credit CEU towards your licenses, please send me an email. Send it to the email, whichever email you want to use is fine. And I will make sure you get your certificate. But please keep looking for the invites for these. And I appreciate everyone being here today. Have a great week.
Bye bye.
Bye bye.